Talk health matters now, and a clinical epidemiologist at the University of Health and Allied Sciences, Professor Margaret Kweku, has advised that the only way to fight off cancer is through periodic screening. She says early detection of the disease will result in a high possibility of survival. She was speaking to Joy News during a cancer screening exercise for police officers stationed at the Volta Regional Police Command.
An estimate of over 3,000 women are diagnosed with cervical cancer, with over 2,000 dying of the disease annually in Ghana. The cause of death, according to experts, is reported for treatment at the last stages of the disease. Due to this, a preventive healthcare approach has been adopted to ensure early detection and treatment to reduce the mortality rate of cancer. Professor Margaret Kweku is an epidemiologist at the University of Health and Allied Sciences and Chief Executive Officer of Kamang Foundation.
We've been talking about breast cancer for ages, and we've been silent about cervical cancer. Now cervical cancer is trying to compete with breast cancer. So the women have double agony. If you don't have breast cancer, then it's cervical cancer. They should screen. And when they screen, when we detect the precancer lesions, that one is treatable. We can treat and cure them. But when they wait and develop the cancer, cervical cancer, we can't cure it, we can manage it. And the management is also very expensive. It's not every woman who can afford. Even if you can afford, the pain involved, you can't pay for it. So I am advocating that women should make use of this opportunity to come out and screen for cervical cancer.
In view of this, the Volta Regional Police Command has partnered with Kamang Foundation to conduct periodic cancer screening for officers stationed at the headquarters. The officers were educated on the cancer disease and offered cancer and hepatitis B screening at a fee.
And we deem it fit and we thought it appropriate to actually partner with them, because as law enforcement agencies in the discharge of our duties, we hardly get the opportunity to go through some of these exercises. And so if it has come to our doorstep, why not? We embraced it, made sure that we are prepared for it, and it's overwhelming the number of statistics that we have been exposed to. So we are enlightened better.
I've been hearing of cervical cancer, but I couldn't get the opportunity to screen myself. But today, I'm very happy and grateful to the team that come around to screen us. So,
long-lasting infection with certain types of human papilloma virus, a common virus that is passed from one person to another during sex, is the major cause of cervical cancer. However, the use of second-hand underwear has also been identified as a mode of transmitting the virus.
Somebody who has human papilloma virus, infected with human papilloma virus, is using a pant, and if the pant is infected and a person hands over that pant to another person, even if the person is not sexually active, can also get infected. And so it means that it's not only those who are sexually active who can get the infection. So I'm advising that we stop sharing panties.
Fred Kwame Asari, Joy News. Ho.